And what are the problems with methamphetamines?
Methamphetamine can cause a whole range of problems for people. Some of those can just be physical, related to the effects of the drug. So methamphetamines work by speeding up your heart. And if you've got a predisposing heart condition, actually amphetamines can cause abnormal heart rhythms and even precipitate kind of angina or heart attack-like symptoms in people. For other people, because it causes a massive elevation in blood pressure, it can precipitate strokes and seizures in people. That's particularly if you've already got epilepsy. Amphetamines make you sweat and can cause overheating. They can also cause dehydration. But probably kind of the greatest physical risk that people don't think about is that methamphetamine can disinhibit you. It can make you go off and do a whole bunch of things that basically put you at risk. And those things are things like driving under the influence of amphetamines, high-risk sexual activity under the influence of amphetamines, and also that amphetamines can make people much more aggressive and violent, sometimes secondary to paranoid beliefs that people might want to harm them. And I think people underestimate the harms from drugs actually related to the behaviours that people undertake when they're taking drugs. The other problems related to methamphetamine are also your mental health. Amphetamines can make anybody feel depressed, and they can cause psychosis in anybody. If you've already got a pre-existing mental health problem, such as depression or schizophrenia or manic depression, you're going to be much more vulnerable to getting those symptoms. Bizarrely, some people are attracted to using methamphetamine when they feel depressed. And for a couple of hours, they might feel a bit better. But the come down can massively worsen people's depression. And people don't have to have any underlying mental health problems at all to run into severe problems with methamphetamine. People can develop massive problems related to methamphetamine after a very short space of time. You only have to use once, get really paranoid, really frightened, end up in a fight, to end up in hospital with a whole bunch of problems. So there really isn't a safe period of use before you might run into problems. You know, that safe period of use might be once or never. In terms of effective treatments for people who have got problems related to stimulant use, medications play less of a role compared to methadone and buprenorphine in the treatment of heroin dependence. One of the mainstays of treatment is actually psychological therapies such as cognitive behavioural therapy. That can very often be combined with some sorts of psychiatric medication, particularly when people have got underlying mental health problems such as depression or anxiety. Where people have got an underlying severe mental illness like schizophrenia, the appropriate use of antipsychotic drugs can also be useful. Some people think that you're only going to run into serious problems with drugs or methamphetamine if you inject. And although injecting drugs certainly puts you at another level of risk in terms of bloodborne virus transmission, you can run into all the severe mental health and physical problems with methamphetamine if you snort it, smoke it, or swallow it. So don't think that just because you're not injecting methamphetamine that you're safe. You're not.